Hi, my name is Dr. Jasleen Chhatwal. I'm a psychiatrist by training, and I'm answering some questions about sleep. A lack of sleep is a very serious condition. If somebody even has disturbed sleep, that too can lead to a series of health issues, all the way from increased stress hormones, which can lead to increased weight gain, difficulty losing weight, difficulty with fully absorbing nutrients. And we also notice that people tend to start having higher blood pressure. So, a lot of ailments that we consider chronic health conditions can get worse when somebody is not sleeping well. From the respective mental health issues, we do notice increased anxiety, a higher predisposition to depression, as well as having increased irritability when somebody is not sleeping. Insomnia can be classified into two major categories. So, one is short term insomnia. This can happen when we go sleep in a new place, when we're under some acute stress. There's more work than you want to have to handle. There can be your children who are going through something. It may be that you yourself have some exams. And then there's chronic insomnia, which is difficulties falling asleep or staying asleep for 3 or more months, for more nights of the week than not. And chronic insomnia is definitely something that you should seek help for, preferably going to your doctor. In terms of acute insomnia, if that's something that's occurring quite often, and if you notice that it's been going on for a few weeks and not settling, you may want to seek help early before it converts into chronic insomnia. Sleeping pills is a colloquial term for medications that may belong to many different classes. Some of these can be somewhat safe, and there are others which have very many side effects. So, when anybody starts to ask me about sleeping medication, I would first refer that person to looking through sleep hygiene tenets and also assessing their own sleep habits. To get a little bit more detail on that, you can watch my Friday Facts from last week, in which we did discuss sleep hygiene. And feel free to send more questions my way. Sleep is one of my favorite topics to talk about. When we further get into addressing and looking at sleep medication for somebody, we typically try to address those based on what the underlying issue is. When it comes to acute sleep disturbance or acute insomnia, sleep medication can be a little bit more helpful. So, say if you're changing your shift from one time of the day to another, you may use sleeping medication for a short period of time to help with that transition. Also, if you're moving and traveling from one part of the globe to the other, and there's a change in the time zone, then somebody may use sleep medication for a short time in that kind of situation. But for chronic insomnia, sleep medication is really not known to be very good or effective, and sometimes the side effects far outweigh the benefits. And typically, what we notice is that if we use sleep medication for a long period of time, it actually does tend to destroy or change our sleep architecture to where sleep is not as beneficial as it could be. So, if at all you're worried about your sleep and you are taking sleep medication, I would say to please go to your doctor and reassess this, because it's just not a great or very helpful way to manage sleep in the long term. If you're not able to sleep well at night, you typically will have trouble staying awake during the day. And I think, especially if you're engaged in anything that requires a lot of cognitive effort or needs a lot of attention, that can be a huge safety risk. So, once again, looking really at your entire environment, what time you go to bed, where you go to bed, even who you sleep with is really important. And then looking at all the ways that you may be hurting your sleep, even unbeknownst to yourself, is important to assess. Sleep is something that is so integral to human functioning, so integral to memory, so important for our bodies to function well, for us to be able to digest our food, maintain our blood sugar levels, keep good blood pressure, that having a sleep disturbance definitely can change the quality of your life, and typically for the negative. So, making sure that you're getting sleep assessed in a very active way becomes very important. Any kind of short term bandages only work for so long. And we notice that the longer somebody has poor sleep, the more difficult it can become sometimes to treat it. So please make sure that you're looking at some good resources for sleep education information, and feel free to send any questions you have to me. If I'm qualified to answer them, I will. But again, anything that's shared here in the video does not qualify physician advice, since I'm not aware of your unique life and your unique situation. I really enjoyed sharing these sleep education pointers, but these are not comprehensive. Thank you so much for listening today. We'll continue sharing Friday Facts every Friday. This was the last week of talking about sleep, but we will come back next week with a new topic. Thanks so much. Bye-bye.